Hello, my name is Vera Dodds and I work at Hamilton Health Sciences. Specifically, I work in the diagnostic imaging department where both inpatients and outpatients visits take place to have images taken for the purpose of diagnosing the patient's condition and determine what the patient treatment plan will be. So currently, equipment is replaced on an as-needed basis. Thus, there's not really a specific projection for how much will be spent each year on equipment. Also, it's important to note that the equipment across all HHS hospitals are all in different ages, different performance levels, have diverse maintenance needs depending on age and on who has produced the equipment and how often it's used as well. All of this maintenance results in additional costs, and currently there's no determined annual cost for equipment maintenance or purchase as previously mentioned. Other equipment purchase and ongoing performance work is required as well. So for example, this includes installation, staff training on new equipment, maintenance services to decrease equipment downtime, proper disposal of expired equipment, and updates and technological upgrades to the equipment as required. And that brings on new staff training as well as the various equipment is updated. So having said all this, some questions to reflect on are, firstly, how would one inventory and plan the replacement of equipment that is most beneficial to HHS? And having said that, which stakeholders should be engaged, and what would be the criteria that would impact your decision making? Please justify your reasoning. Secondly, the HHS Board of Trustees is looking to standardize their annual costs. What internal and external factors should they consider? How would they go about implementing change associated with standardizing these costs? And what potential drawbacks must they consider when implementing this change? And finally, the third question, consider overall the savings and efficiencies that can be identified through the establishment of a proper process for each step of equipment management. So the desired and outcome being well established, an organized procedure for assessment, purchase, installation, maintenance, and disposal of all of this diagnostic imaging equipment across the 6 different hospitals. For each step in the product life cycle, identify some potential best practices for equipment management, and in addition, for each step, advise on some unproductive practices perhaps to avoid when managing each step of the product life cycle.